Good morning, everyone. Honorable our lecturer Miss Dewi Untari and unforgettable all of my friends whom I love. I would like to say thank you for coming in our presentation about breastfeeding. It's great to see you all. First, I would like to introduce myself. My name is Dwi Rotul Aini with student ID number 22104010 and my partner Linda Tu Soleha with student ID number 22104026. Next, in this presentation, we will discuss about the first definition of breastfeeding, the second, how breast milk is produced, the third, step to successful breastfeeding, and the fourth, benefit of breastfeeding for mother and baby. Next, first I will explain to you about definition of breastfeeding. Breastfeeding is the main way of providing ideal food for the growth and development of healthy babies and has biological and physiological influences on the health of mothers and babies. Breastfeeding is a natural activity of giving milk to babies or toddlers from the mother's breast. Next, let me describe about how to breast milk is produced. The way breast milk is made starts from a collection of cells called alveoli in the breast. Alveoli have shape like grape with many clustered spots and increase the hormone progesterone and estrogen in the body will trigger the alveoli to make milk in the breast. Hormones released during pregnancy cause the milk ducts to expand in size and number. After successfully making milk, the alveoli squeeze milk and pass it into milk ducts called ducts, which have many branches like highways. This duct allows milk to come out through the nipple when the baby is born later. But sometimes, breast milk comes out when the mother is still pregnant. It usually occurs during the second and third trimester of pregnancy. Next, now I will explain you about step 2 successful breastfeeding, which there are 10. Number 1. Establish a policy to increase breastfeeding which is routinely communicated to all officers. Number 2. Conduct training for officers to implement the policy. Number 3. Provide an explanation to pregnant women about the benefit of breastfeeding and its management starting from childhood pregnancy, infancy until the age of 2 years. Number 4. Help mothers start breastfeeding their babies within 60 minutes of delivery in delivery room. Number 5. Helping mothers understand how to breastfeed properly and how to maintain breastfeeding even if the mother is separate from the baby for medical indication. Number 6. Do not give any food or drink other than breast milk to newborns. Number 7. Carry out rooming in by making sure that the mother is with the baby 24 hours a day. Number 8. Helping mothers breastfeed as many babies as mothers want without restriction on the duration and frequency of breastfeeding. Number 9. Do not give passive or passive breastfed babies. Number 10. Seek to form breast milk support group in the community of and refer mother to this group when returning from the hospital or maternity home or healthcare facilities. Next, and last, I will explain you about the benefit of breastfeeding for mother and baby. The first benefit of breastfeeding for mother. There are two. Number one, overcoming trauma. Can relieve trauma during labor as well. As with the presence of a baby for the first time can be a mother's life encouragement. After giving birth, mothers are usually prone to experiencing it baby blues syndrome, Moreover, this usually happens to mothers who are not used to it and are not even willing to give exclusive breastfeeding for their babies. However, by breastfeeding, the feeling of trauma will slowly disappear on its own and the mother will get used to breastfeeding her baby. Number two, prevent breast cancer. In addition to creating conditions maternal and mental health to be more stable, exclusive breastfeeding can also minimize the risks of breast cancer. Because one of the causes of breast cancer is nursing mothers is lack of breast milk exclusive breastfeeding for their own baby. Next, then I will explain you about benefit of breastfeeding for babies. There are some benefits of exclusive breastfeeding for babies 0 until 6 months first as follows. Number 1. Prevent disease. Exclusive breastfeeding for babies given by mothers turn out to have an important role, namely increasing the baby's body resistance. Therefore, it can prevent the baby from developing various diseases that can threaten the baby's health. Number 2. Help the baby's brain and physical development. The most important benefit of exclusive breastfeeding is that it can support and help the baby's brain and physical development process. This because at the age of 0 to 6 months, a baby is of course not allowed to consume any nutrition other than breast milk. Therefore, for 6 months in a row, breast milk given of the baby of course, has a big impact on the baby's brain and physical growth in the future. Okay, presentation in this morning have done. Finally, the conclusion of this presentation will be delivered by my friend Linda Tusoleha. The time is yours.
Okay, here I will conclude the presentation that was explained by my friend. The conclusion of this presentation are: the first, breastfeeding is natural activity of giving milk to babies or toddlers from the mother breast. The second, breastfeeding has benefit for the mother which can overcome trauma and prevent cancer, while the benefit for the baby are preventing disease and helping the baby's brain and physical development.
Maybe this presentation is enough. If there are any mistakes, we apologize. And the last we say, Assalamualaikum warahmatullahi wabarakatuh.